hide my tears when I say your name, but the pain within my heart, it's still same. We always express the word tear as a symbol of pain, sadness, or sorrow. We often forget it is very important for our normal eye health. So, hello everyone. Today's topic of discussion is what is dry eye and how to get relief from it. We will discuss the whole topic in three divisions. First, what is dry eye and the causes behind it. Second, the treatment. And the third, most important, what the measures we should follow to prevent future dry eye problem. Just before going the main topic, I will want to add few words. What is the cornea? The center black or brown portion is cornea, and the conjunctiva is the around the cornea. The whitish portion is our eye is a conjunctiva, and there is a few glands around the upper and lower eyelid, which are responsible for tear secretion. They are very important for our normal tear health. And this secretion is controlled by emotion. That's why we are express the tears as a symbol of pain, joy, and sorrow. And also it is controlled by some reflexes like mechanical reflexes, some allergy, dust, that's all. Now our first division is what is dry eye. When our cornea and conjunctiva is not properly lubricated, then we can call it is dry eye. How we get know how I am suffering from dry eye? There is a few symptoms like irritation, itching, foreign body sensation, redness. These are usually we seen in a dry eye patient. Now causes. What are the causes for responsible of dry eye syndrome? Number one causes are age. During age, these glands which already we discussed, the responsible of normal tear secretion are become atrophic, or you may say are not acting properly. Number two causes are hormonal changes. We can see in a pregnancy period, menopause, and the lady who use the OCP or oral contraceptive pills. Number three is the environmental factors. The windy atmosphere or excessive heat, these are also responsible for dry eye. Number four, the most important cause nowadays is prolonged reading. During prolonged reading, we often forget to blink. That's why our tears is not inadequate lubricate or inadequate distribute all over the cornea and conjunctiva, as well as tears are more evaporate due to prolonged opening of eyes. Also, some few systemic diseases are responsible for dry eye like rheumatoid arthritis and etc. Now treatment. Obviously, as an ophthalmologist, we advise the eye drops according to severity of disease. Sometimes we advise 4 times daily to 6 times daily in daytime. And we also advised eye ointment during night or during your sleeping time. There are also few surgical options if these eye drops and eye ointments are not working well. And also we prescribe to avoid contact lens during this dry eye period. Now the third division. As I say, it is the most important topic because these preventive measures we can, if we follow these measures, we can prevent our future dry eye problems. Avoid dry and windy atmosphere or avoid some very heat. Use sunglasses for prevention of this heat or this windy atmosphere. Second of all, most important is treat if you have suffering any eye allergy problem, because dry eye and eye allergy is very interlinked with each other. So please properly treat if you are suffering any eye allergy problem. The third point is force to yourself for several blink, especially when we are doing some reading, prolonged reading, or doing some work with very concentration. Try to remember, please force yourself for several blink. It's very important, and also important for normal distribution of tear film around over our eye surface. Number 4 is very important for ladies. Please carefully and completely remove your eye makeup, because usually we use our eye makeup around the eyelid. As I told you earlier, these glands which are responsible for tear film secretion is usually present around our eyelid. So if we block this gland with our makeup or cosmetics, then obviously dry eye can occur. So please remove carefully. Don't force any extra pressure during removal. Carefully, gently, and completely. Another important, avoid smoking. Smoking kills anything. The one of the most important preventive measures is proper diet, which are rich in omega-3 fatty acid like seeds, chia seeds, flax seeds, in the nuts, cashew, walnut, and the salmon fish. This type of foods are rich in omega-3 fatty acid, and also vitamin C rich diet like citrus fruit, green leafy vegetables. If you include this type of diets in your regular food, then obviously, hopefully, you can prevent your future dry eye problem. Lastly but not least, drink plenty of water, because when we are dehydrated, our body have not enough amount of water, then obviously this type of secretion will be reduced and dry eye problem will be arise. So at least 5 to 6 liters of water daily is very important. At the end of discussion, I just want to say, from now, we should think the other side of tears apart from pain, sorrow, sadness. This is the God's gift for our normal eye health. Don't judge anything only based on one side, because every coin has two sides. So, loves your tears.